Within this video, we are going to look at treating the legs with the client in prone, so looking at the posterior chain. So straight away, you can see Tamsin applying some lotion and then putting it on the entire posterior surface of the leg, so from the calf all the way up to the top of the hip. That's really important just to sort of get initial contact with the client, get the lotion applied, and also for you to have an initial feel of what you're sort of looking for. Are there any immediate areas that sort of give you an idea of tightness while you're warming up the tissues as well?
So I'm doing quite a lot of effleurage here, but you'll remember these muscles are quite big, so you need to really sort of build into it. So my strokes would have started very light and slowly got slightly heavier as we went along. Now that I've finished full length leg, we are focusing on the upper leg first, which is always the rule: upper leg first, lower leg second. And here we've got some modified cam and spindle because my hands are too tight to have my fingers outstretched. But also when you're working somewhere like that, actually if you wrap your fingers around, you don't get them under the towel, so you sort of protect yourself and your client a little bit there.
Yeah, really important that you're not having straight fingers, that even as a guiding hand, that then go up under the towel.
Yeah.
It's important to make sure that the only surfaces you're massaging are those exposed by the towel, so the client sort of is their modesty is maintained. Again, you then move into here some like really lovely broad strokes sort of through the forearm glide, and then here's some nice picking up. Now this is lovely on the hamstrings. There's a bit of variety, get some sort of lifting, and you start to feel areas that indicate to you that there's a bit more tightness in there that you can focus on later on in your treatment.
So here you can see the bolsters actually underneath the ankles this time, just taking the pressure off the knees and also off the lower back because you've taken the stretch out of the hamstrings.
Well, once you then get through to this, add a little, again, variety in, bit of petrissage. So we're looking at a bit of ringing here. Now, what's really interesting, again, Tamsin's moved her body. She's completely face on to the direction of force. Now, that means that although with the elbows bent, it means that you're able to completely move in towards you. You're not trying to twist your own body to get the pressure on.
So this is interesting. I have gone for a broad hand compression. So I've used kind of like the cam and spindle approach, and you can see me then just chatting to Charlotte about it. And I've just taken my hand away there so you can actually see what I'm doing. So I've gone in, count to 10, back out. But this is quite good on somewhere like the hamstrings where the whole muscle is tight. I'm not overly willing to let go because small compressions won't really work unless it's a small area. So this is good on maybe a spasmed type muscle.
So again, what was really good through that was the direction of force. Tamsin had really straight elbows, and that means that you can then really target and use your own body force to create that pressure. And then into here a little bit of butterfly, so with reinforced thumbs, but just working little bits so you can see you do up a bit and then repeat up a bit and then the next stage. And that means that again, you're just reassessing all the time what's going on within this muscle.
And afterwards, some nice flushing through, and then some kind of localized flushing through as well there, which can be quite handy at times.
So what's also really important to note, we've mentioned it previously, but it is so important to work from the back of the knee all the way up to as high as possible at the top of the muscle. You can see that when Tamsin goes to the top, it's right up to the borderline with the towel. So once you sort of start to get to the end of your treatment for your upper limb, again, as you want to move on to the lower limb, start to flush through the whole limb again. It's a really nice sort of transition phase there.
So here now we're on to the calf or the lower leg, again starting with some effleurage, nice and slow, nothing too rushed. A little bit of cam and spindle, done properly for a change. And you can see me just working my way around. So I've kind of started one side of the calf and slowly worked my way around it, just looking and feeling for things really.
So here again, a little bit more targeted through a little bit of butterfly, but using the fingers to guide. So you can see how Tamsin's hands are wrapped around the calf. However, the pressure is just coming through those reinforced thumbs in the middle. But what it means that you can do is move your whole hand in order to guide the direction. It avoids sort of slipping around, doesn't it? You don't want to lose control of that technique.
No. So although it's supported on the bolster there, I have actually put it onto my leg. But if you can see, my leg is very much underneath Charlotte's leg, so there's a very little gap. It just makes it easier for me to work sometimes. You can first of all straighten up through the body a little bit, but also it helps to prevent the client from tensing up their calves, because it's a lot harder to do it in that position than it is actually flat. And then I can work around the ankle with a little bit of detail without having to double over too much. So it's fine to do this. Just make sure you really support their leg with your leg and watch the level of pressure you're putting through when it's in this position.
Yeah, absolutely. Really important. The other thing I find really helpful about this is it actually does put the calf in even more of a relaxed position. So you're taking off an extra degree of tension, which, especially if someone's sore, I find can be really useful over and above that which a bolster would provide.
Couple of forms of shaking here. So the first one was shaking with the foot, and this is kind of, I call it the finger wobble really, because when the calf's in that position it's really nice and loose, so you can just really sort of flap it around a bit.
So hopefully that gives you a few ideas now of how you can link techniques on that posterior chain. Loads of variety, and as we've said before, everything goes. Use what you find works best for you.